Yeah.
Hi, this is Gemma from ASD Rocks, just sitting here with Philip Bliss, dentist of the Stars being my two younger children, Bo and Finn, and wanting to get a professional opinion in regards to treating children with ASD. Philip, you've had some experience treating, obviously, my son. And,
Indeed, and many others.
And many others. So how long have you been a dentist?
I hate to say it, but it's 47 going on 48 years.
48 years. So you've had some experience probably with people who, prior to when autism and ASD was even a diagnosis.
Absolutely.
Yeah.
Yes. I mean, they were just treated as very difficult children, very difficult patients. But
Yeah.
there was not the labelling at that stage. In many respects, well, I know I have, and I think probably a number of other dentists do. You treat every child patient as though they had problems and disabilities until proven otherwise. And I mean, it was like 30, 40 years ago when we were treating patients with AIDS. You had to, in the early days, you had to predict who did, who didn't. Now you treat everybody as if they had AIDS.
I understand.
So with children, there is such a variation, such a huge, literally, spectrum that some children with known autism can often be much better behaved and much more cooperative than
a spoiled brat.
Absolutely.
And we talk about that a lot in ASD Rocks. We talk about disciplining your child. Are you disciplining an autistic behaviour, or are you disciplining a child that's being just a brat, and
Yep.
being able to
Yep.
choose between, as well as setting up your children for success. So it must be difficult being a dentist. With most people, they have a fear, let alone with children or adults who have ASD.
Not necessarily. It's very interesting, more and more nowadays, because dentistry has become much easier. Treatments become far less invasive. A lot of dentistry nowadays is just not painful, it's just straightforward. Probably the bigger problems, and I think this runs through whether patients have a disability or not, is that a lot of fear and a lot of concern about going to the dentist is transmitted mainly through mothers who have had bad experience in the past. So basically,
As many fears are passed on to our children.
Absolutely. But particularly when it comes to dental, a lot of parents and most kids come with their mums, but it's how mothers talk to their children about coming to the dentist. It's the words used. It's the body language, it's the over-concerning, sort of trying to cuddle, when very often left to their own devices, most children can be perfectly normal.
So in fact,
fine.
You could set your child up for success or failure just in the way.
Before you walk through the door.
Yeah.
And that's actually a major problem and a major factor in how all the rest of it goes.